Hello, everyone. My name is Dr. Kwande, and thanks for joining us or joining me today. I'm going to be talking about uterine fibroid embolization and its utilization in treating uterine fibroids. This is a safe, effective, and life-changing fibroid treatment, and I'm excited to share this with you. Talk a little bit more about this. I feel like this is a great forum for me to teach you a little bit more about uterine fibroids and this procedure and how it can help you through your journey through healthier living. So, so we're gonna throughout this presentation, we're going to answer some questions, and I'm gonna list some of these questions. What are fibroids? How do I do a uterine fibroid embolization procedure? Does the procedure hurt? We're going to compare uterine fibroid embolization versus hysterectomy. Why OBGYNs don't recommend uterine fibroid embolizations. Now, stay tuned for this. Don't leave before I answer this. This is a very important question I'm going to be answering. And it'll be a fun one, too. And does insurance cover the costs? How long does the procedure take? And how much downtime do you have after a uterine fibroid embolization procedure? So obviously, I'm a stranger to most, and maybe some of you already know who I am or have looked me up. But let me tell you a little bit about myself. I am a board certified interventional radiologist. We are the only ones that are board certified to do this procedure. Um, I trained at several prestigious institutions, including the University of Pittsburgh and the Johns Hopkins Hospital. Here is a picture of myself and my colleagues taking a picture in front of the famous Johns Hopkins dome. And after fellowship, where I had an NIH grant studying, we had some interest in research inquiry. I was recruited to my first job at Washington University in St. Louis, which we call over here Big Barnes. It's called Barnes Jewish Hospital. For those of you out of St. Louis. And I enjoyed my time there. I came in with like a bunch of grant money, and I did a lot of clinical medicine, a lot of research stuff there. Um, I was fortunate to publish over 80 peer-reviewed abstracts and manuscripts. I collaborated with medical students, residents. I had a research lab, collaborated with fellows. And here's one of my medical students that did a project with me. We actually published a paper together, and I just enjoyed mentorship and enjoyed teaching. Here's one of my fellows. We were at Washington University Hospital, and I was teaching him how to do a certain procedure. And we took a picture because he was headed to the University of Pennsylvania after this as a faculty. So it was really a great time for me, but I was ready to make a change. I started my practice at Mint in 2019, and I felt that I felt that there was poor access to medicine, poor access to the stuff that I did. I felt like patients were somewhat misinformed about their options. I also felt like education was lacking, both with patients and also with doctors. Doctors needed to know more about the different types of minimally invasive procedures that we did, and I felt I needed to reach more people clinically. And so I gave up my academic position and started my practice at Mint. My practice started in 2019. 8 months later, COVID happened, but we persevered because we were mission focused. We had a mission, and we knew nothing can stop us. And we grew despite the fact that COVID could have shut us down. We were resilient, and now we have an amazing practice. We are located in St. Louis. Here is the famous St. Louis Arch. If you guys have not been to St. Louis, come and visit. Some people are in St. Louis and never really been to the Arch, but I love St. Louis. I love it. It's beautiful and lots of great places to eat. But that's where we're located. We're located very centrally in St. Louis. We're very easy to find in a place called Town and Country. Here's what my practice looks like. You can kind of see very welcoming procedure room. We have nice music that kind of, almost hypnotizes you in a way. I love it. And so, yes, we make it quite inviting for people. So, and this right here is my procedure room. This is where we do all our procedures. Everything is state of the art. It's relatively new. And yes, we do a lot of procedures. I get a lot of support, good supporting staff here. And so if you ever visit us, you'll be well taken care of. And here is my beautiful team. They're all smiles because they're faking it for the camera. No, I'm just kidding. We love working here. I love my staff. I love everybody. We have a great time. And actually, if you come out here, you would actually find me singing most of the time. And they tell me to shut up half the time, but I love to sing. I love to sing my even when I'm doing procedures. So my patients tend to like it pretty well. So let's get to the nitty gritty. Let's get to the agenda here. What are fibroids? Well, let me show you. So fibroids are benign growths that they're made of muscle and they grow in the uterus. They grow within the body of the uterus. And I'm sorry if this bothers you, but this is really what it looks like when the fibroids are taken out of the uterus. It can actually get that size to the point where when we measure fibroids, or when we say to a woman, oh, you have a fibroid of this size, a lot of times we kind of make a parallel to how many months pregnant. So we say this is a 7-monther fibroid. This is a 5-monther. So it can get quite large. A lot of people have fibroids, but just don't know they have fibroids. There are a lot of women that have fibroids that are not causing symptoms. But if it does cause symptoms, that's when people usually come to seek care. Fibroids are not cancer, okay? They're not cancer, okay? But they grow almost like a cancer, but they don't invade different structures. They just compress on different structures and then cause problems. When they get really big, they can cause heavy menstrual bleeding. So a lot of women have heavy menstrual bleeding. And for years, they never knew what caused it, and it ended up being a fibroid. Maybe they found it when they were pregnant with an ultrasound. When it gets really, really large, it can compress on the bladder. The bladder sits right in front of the uterus. It can compress it and cause increased urination. So you wake up several times at night to go to the bathroom, or you can't hold your urine. You have to constantly go to the bathroom. That is classic for fibroids compressing on that bladder. It can also compress on the rectum, which is behind the uterus, and cause constipation. So you can have a patient that has heavy menstrual bleeding, increased urination, and constipation, and never know what the problem is. And they're going to different specialists. They go to a urologist for the urinary problems. They go to a GI doctor or gastroenterologist for the constipation, and then they come to the OBGYN for the fibroids. But it's one thing that's causing everything. So fibroids are pretty interesting, and they cause significant problems. Here's an MRI of uterine fibroids. We typically get an MRI on all our patients just because we want to make sure there's no malignancy, there's no cancer. We want to make sure that what we're really dealing with is just a fibroid. I'm sorry, that just went forward. Here, I want you to focus right here. You can see the fibroids. They're enlarged, they are enhancing with contrast. That's what it looks like. You can see this big mass occupying the pelvis. So you can imagine how it would compress on adjacent structures, adjacent organs, and that's what we're dealing with when we talk about fibroids. Now, so obviously, the standard of the classic way to treat fibroids was a hysterectomy. This is one of the oldest procedures ever made. In fact, it's one of the most common surgeries that are performed in the United States, and the majority of hysterectomies are performed for benign things such as fibroids. It's interesting that there are treatments for fibroids where you don't have to remove the uterus, but it's underutilized. Hysterectomy is a very, very common procedure. A lot of women have their uteruses removed. My mother had a hysterectomy when I was younger. She almost died during the procedure. Not to say that everyone almost dies, but my mom was in Nigeria at the time and had to have the procedure. And, she had some complications, and she had that. So My wife has fibroids. Her mother-in-law had fibroids. So it's very, very common, especially in Black women. But when you have a problem like a headache, we don't remove the head, right? If a person has a heart attack, you don't remove the heart. So when you have a uterus problem, why remove the uterus? So there are different options where you can preserve the uterus, and women are entitled to know what their choices are, because they're quite there are options for them rather than do a procedure that is very invasive, such as a hysterectomy. Not to say that hysterectomies don't work. It's just there are options for you. So we're gonna go through this presentation right here. This is kind of like a 3D image of what is like, or what a uterine fibroid embolization procedure is like. You can see that's a fibroid right here, and those are blood vessels feeding the fibroids. That's the uterus right there, and there are fibroids in the uterus. Okay, so we make a tiny little incision in the wrist right here. We go into the radial artery and we pass a small tube all the way down. So right now we're navigating to the arteries that feed the fibroids, and we have a little tiny little tube that gets really, really close to that fibroid. And when we get there, we can embolize it. We usually use tiny little particles smaller than a grain of sand. And these particles, they're inert. They don't attack you. They're not, you wouldn't even know they're there. They don't cause any infection. They don't go anywhere too. They just get right to that area and they stop the blood flow from going to the fibroids. And then the fibroid over time shrinks and dies. And that's what gets or that's what helps the symptoms go away. Okay, so now the simple question is, does uterine fibroid embolization work? Now, I won't be here if it doesn't work, obviously, but it's an important question to ask, right? So let's ask the oh so famous ChatGPT. I don't know if you guys know about ChatGPT, but it's like my best friend right now. I feel like I've been so efficient. I'm just gonna ask it a simple question, but I'm gonna say keep it short because ChatGPT can go crazy. So let's see what it says. Yes, it does work. So don't believe me, believe ChatGPT. No, I'm just kidding. But no, uterine fibroid embolization absolutely works. We see that it's pretty effective in 85 to 90% of patients. And I always tell patients, 85 to 90% is pretty high, right? If I tell you I can treat your fibroids with a tiny pinhole incision in your wrist, and you don't have to have major surgery, and there's a 90% chance you will get better, you'll probably take it, because you having a uterine fibroid embolization does not stop you from getting a hysterectomy if it doesn't work, all right? But if you have a hysterectomy, you can't get a uterine fibroid embolization. So it's a good procedure that is not as invasive, that you can do, that takes 20, 30 minutes to do, that you can go home the same day, no hospital stay, and you can get your symptoms taken care of with a high success rate. Okay, so we're going to talk about how I do a uterine fibroid embolization. So here's me. Okay, I'm going to play this video. Okay, so remember we talked about the incision in the radial artery. So I'm going into that artery. You can see the needle. And I'm advancing my wire through, small, tiny pinhole incision in the wrist. And then I advance my sheath. My sheath is basically my path to get into the artery. I'm just making sure right now that I'm in the right place, so I'm flushing the sheath. So then I'm gonna take a small catheter the size of a strand of spaghetti, and I'm gonna put it through that sheath, which is my pathway. And I'm gonna go into your artery, come down, all the way, heading down to the pelvis. I'm gonna find that artery. I'm gonna inject some dye to confirm I'm in the right place. And then that's the embolic mixture. You can see me mixing the grains of sand. And then it's time to inject. And that's me injecting. The mixture is mixed with some dye so I can see what's going on. And then once I'm done, the incision is closed. We use like a little radio band and we wrap it around the wrist. We put a balloon and then we keep the radio band for 30 minutes and we take it down, and that's pretty much it. So again, this is like a 30-minute procedure. There's no big wind up for this. Again, guys, this is a procedure that you can do in 30 minutes and you're back home that same day, and it gives you similar quality of life and symptom control compared to a hysterectomy. So it's I just feel like it's a great procedure. Okay, so this is a patient that I have, or that I had. You can see that's the fibroid right here, the huge uterus. You can see all these large fibroids all around. And to prove this is the same patient, you can see this patient had some hardware in their spine that's causing this black artifact that you see in this MRI. So you can see it's the same patient, but look at the difference. Look at the difference between this uterus and this uterus. Look at all these fibroids are all gone. And you can see, look at the compression in the bladder right here. There's a lot of compression. This patient complained about increased urinary frequency and whatnot. And look, you can see expansion of the bladder after. So this is literally what you see. You don't have to remove the uterus for you to get these kind of results. This patient just had an embolization. Here is another example. You can see this is a patient with a large, humongous fibroid right here. I embolized it. That's a follow-up MRI. You can see it's gotten smaller, and then follow-up MRI, you can see this. This is a dead fibroid. It has shrunk all the way down. And remember that fibroids, they actually don't have to leave your body, because most people have fibroids. A lot of women have fibroids. The question is, are the fibroids causing problems? And so when you have a large fibroid, that's when it causes problems. In this embolization, this is pretty much a dead fibroid, and this actually continues to shrink down until it becomes nothingness. And you can see the size of the uterus. It has gone from, you can see this is the patient's belly button around here. You can see the fibroid is around the level of the belly button, and you can see kind of it going down to the point where it's like below the pelvis now. So you look at that, high, low, low, all the way down. So a lot of that bloating and that feeling of that bloating that women feel. Sometimes they feel like, oh, I've gained some weight, just a lot of my belly. Sometimes it's just fibroids. And when you do the embolization, they feel a lot lighter. They feel a lot less fatigued because they're not losing a lot of blood. So does the procedure hurt? Okay, so I'm just going to show you this picture. This is that pinhole incision I was talking to you about in the radial artery. That's 2 weeks after the procedure, or a week after the procedure or whatnot. That's the entire incision. There's no big incision. This is a painless procedure. Now, embolization of a fibroid or embolization of fibroids is not a painless procedure. The procedure itself, while you're in there having the procedure, there is no pain. However, when you embolize the fibroid, you're going to feel some cramping and some pain in the area. I always tell my patients that just shows I'm in the right place, because I'm doing an incision over here. When you feel that cramping and that pain in the pelvis, that just means that I was in the right place, right? Yeah. So, but no, it's nothing compared to what you would get in major surgery like a hysterectomy. It's just symptoms that could be managed. We give you pain medications. We give you some other medications that can help you get through that. Again, 99.9% of patients go home and they're fine. They're fine at home with the medications we give them. So now let's compare uterine fibroid embolization versus hysterectomy. So I have a couple charts I want to show you, not to bore you. There are other treatments for for fibroids. However, these are the only two options that treat all fibroids in one session. There's uterine ablation, there is focus ultrasound strategies, there's other kinds of stuff. But if you want to treat all the fibroids in one session, there are only two procedures: uterine fibroid embolization and hysterectomy. Okay, just letting you know. So that's why I compare these two, because comparing a uterine fibroid embolization to another procedure like a myomectomy or an ablation, it's not a fair comparison because they don't treat everything, right? So here are some tables. I don't mean to bore you. I'm just going to give you the highlights. The highlights are in red. Hint, hint. Um, so as far as invasiveness, this is obviously minimally invasive. Is catheter-based. Hysterectomy is major surgery. The recovery time is a lot less, usually 1 to 2 weeks. With a hysterectomy is a lot longer, 4 to 6 weeks, or 2 to 3 weeks if it's laparoscopic. Most of my patients, usually it's about a week or less. Okay. Also, as far as downtime and work, depends on kind of work you do. If you're like a desk job, you can probably go back in a week. But if you're doing something more physical, we probably require for you to stay home just a little bit. Not because you can't work. It's more for your safety. If you're taking pain meds, we want you to not be loopy when you're going back to work, etc. Minimal blood loss. As far as fertility and hormonal factors, uterine fibroid embolization preserves the uterus. So there's a potential for pregnancy. With a hysterectomy, your uterus is gone, so there's no chance for pregnancy whatsoever. And if you do a hysterectomy where you remove the ovaries, there will be a chance, or well, it will affect your hormonal status. Whereas with UFEs, with uterine fibroid embolization, there's no impact to your hormonal status in most cases. Now, as far as the post-procedural factors, there's a higher infection risk, obviously, with a hysterectomy because you have a bigger incision. There is more risk for complications because it's a bigger operation. That's just the way it is. The bigger the operation, the more the chance for adverse effects. And as far as effectiveness, we did talk about that. Uterine fibroid embolization is effective in 85 to 90% of patients. Fibroids may regrow because you do have your uterus, but I will say that the older you are, the less likely it will grow back. Obviously, if you do it in a 20-year-old that has a uterus for the rest of their lives, there is a chance it can grow back. But the older you are, the less chance it will grow back. But nonetheless, this 85 to 90% success rate in a procedure that takes 20 minutes and 20 to 30 minutes and has a tiny little incision. So for most patients that come to me, it's a good first step before considering a more extensive procedure like a hysterectomy. Okay, so this is just a patient testimonial. Bear with me here. I just want to show you what patients have to say about uterine fibroid
Gradually
embolization.
became very embarrassing. With when I say heavy bleeding, I mean I was having accidents, and it was affecting me in my personal life, being able to just go out and have fun. Um, Also in my work life, just always worried about constantly maybe having an accident at any given point in time because it would just come on suddenly, and the pain started to increase, abdominal pain. I chose UFE because I was looking for an alternative to hysterectomy. When I saw my gynecologist for treatment, he immediately said that we'll just do a hysterectomy. And I personally just wanted to be able to go through menopause and the changes of life that I need to go through naturally as possible. So when he said that to me, I decided to look for alternatives. And while looking for alternatives, I discovered a procedure called UFE. And at that point, found Dr. A in my area who specialized in UFE and wanted to reduce the number of hysterectomies given to women. So I sought his help. When I came to Med, it was just to me one of the biggest blessings ever, because they made me feel so comfortable and at ease, and I felt like I was in good hands. And when Dr. A told me that I would be a good candidate for the surgery, for the procedure, um, I just felt really, really comfortable with him and his staff. They were always checking on me to make sure I was okay. And that's before and after the procedure. So I have nothing but good things to say. Like a new woman. So, literally, like a new woman. I have no regrets. Minimally invasive procedure that gave me the results that are just really unbelievable. I feel like I'm going through menopause naturally, and I have no more heavy bleedings, no more abdominal pain, no more abdominal swelling. My weight loss, my anemia, everything has been corrected. Thank you, Mint and Dr. A, and all your staff. Thank you very much.
Okay, thanks for your patience there. As you can see, she went to our OBGYN, and our OBGYN did not even recommend a uterine fiber embolization. And when I was at Washington University, my academic hospital, I saw a lot of this, and it bothered me. And that's actually one of the biggest reasons why I left to do this, because I really felt that patients were not told the truth of what their options were. So, so I guess the question would be why OBGYNs don't recommend uterine fibroid embolizations. And I told you to wait for this question, but I've kind of answered a little bit about it. But we're going to ask the almighty ChatGPT, because, ChatGPT is never wrong. No. Oh, well, maybe they could be wrong sometimes, but just ask them, why don't OBGYNs recommend uterine fiber embolizations? I always say keep it short, because it just goes long. So now you can see they often don't recommend uterine fiber embolizations because they may lack training in the procedure, view it as outside their specialty, or prefer surgical options like hysterectomy or myomectomy, which they perform themselves. Some may also have limited knowledge of uterine fibroid embolization's effectiveness or misconceptions about its outcomes. Again, it's what I said is, they would recommend things that they do. They have a hard time recommending a procedure that they don't do, right? So if you think about it, like if they're in a hospital or if they're in a clinic, they'd be like, well, I can always do this. Why send you somewhere else to get this done? I believe in this. Maybe my attendings, the people that taught me when I was a resident, did not believe in uterine fibrinoization, because they were kind of like, maybe they weren't aware of it. They was more dated. Maybe they're older OBGYN that are not used to uterine fibrinoization. But I bet you I dare you to challenge your OBGYN. Talk to them about uterine fibrinoization. If they tell you, oh, you can only get a hysterectomy, challenge them and say, hey, well, I've learned about uterine fibrinoization. Tell me more about that. Challenge them, and ask us for a second opinion, if you will. But they all know about uterine fibrinoization. They all know about it, and they know it works. So they just don't typically recommend it, because they have to refer out for it. And then some of them might have metrics they go by in the hospital. They have to do a certain amount of cases or whatnot. But this thing works. And then sometimes I've seen some patients, I would see their OBGYN notes, and it would show in the notes that we told them about all the options, including uterine fibrinoization. And then I would ask the patient, did your doctor tell you about this procedure? And they would be like, no, they didn't. So also look at your notes. They usually put uterine fiber embolization as a choice in their notes, but they might not tell you about it. So these are little secrets I want you to know. But again, you don't have to believe me. You can go online, go on Google Scholar, and check the benefits of uterine fiber embolization and compare it to hysterectomy, and you'd be surprised, or maybe you're not surprised of what you're going to find. And again, I'm not just saying this. This is Condoleezza Rice, who had fibroids and ended up having a uterine fibroid embolization. So again, it's good enough for Condoleezza Rice. Look at the dates that it was done in 2004. This is literally 20 years from now. That's 20 years ago. This is not a new procedure. This has been around for so long. So if you don't know about this procedure, or your doctor doesn't tell you about this procedure, it's really honestly a shame. And this is Cynthia Bailey from Real Housewives of Atlanta, who also had a uterine fibroid embolization. So you're not the only one that's having this procedure. This is not anything new. I wish I could say I was the one that invented this procedure. I did not. There's nothing novel about this. This is a straightforward procedure that could be done in an outpatient setting and takes about 20-30 minutes to do. Does insurance cover the costs? Of course they do. This is not a new procedure. This is not an experimental procedure. All insurances cover it. There's nothing more to say about that. If you don't have insurance, we do have cash plans and payment plans that you can do to get you taken care of. Get you taken care of. Now, how long does a procedure take? It usually takes about 20-30 minutes to do. Again, it's not really a big procedure. And then you go home the same day. How much downtime? We already talked about this. The downtime is about 1 to 2 weeks. Most people under 1 week, but not much downtime. Usually, you can go back to work relatively quickly. So this is the final slide, guys. It was a pleasure talking to you guys. I feel like my throat is dried up. I have a little bit of coffee here. Let me drink some of that. If you're interested in learning more, we're offering a free virtual screening. It's just a phone call. We'll chat with you, maybe answer some of your questions. It's not a true consultation. If you want a true consultation and you're just ready to do it, you can call that same number and get a consultation, an actual consultation, and come in. But we do offer the free virtual screens because sometimes women don't even know what they have. Maybe they just think they have it, and maybe they don't have it or whatnot, or just want to feel us out. You can call for a free virtual screening. It's about a 15-minute screening, and there's no obligation, no payments. We don't even take your insurance. We will schedule you and chat with you about your options and your journey. We would not, in that virtual screening, we would not be making a treatment or a diagnosis or treatment recommendation. We'll be basically getting a feel and seeing, okay, do you have fibroids? Yes or no? Do we feel like you may be a candidate or whatnot? And giving you some more information and maybe even navigate you to the right place. Maybe you don't need us. Maybe you have something else that needs a different provider will navigate you to the right place. Here's my contact information. You can take a screenshot of that. I have my website, the email, and also the phone number. So take a screenshot of that. Social media handles, guys. We have stuff in social media. We post all the time on stuff. I have a lot of tidbits and information about different things we do. We have a YouTube channel where we have a lot of our testimonials. So please feel free to stalk us as much as you want. And call us if you have any questions. The last thing I'm going to do is I'm going to answer a few questions on the chat. Some of these questions I feel like I've answered already. How do I know I'm a good candidate for a uterine fibroid embolization? We don't know if you're a good candidate until you give us a call, but most people are. It's very rare to find someone with a fibroid that you can't treat. It really is a procedure that is pretty universal. What is the recovery time for you? Okay, we answer that. Will uterine fibroid embolization affect my ability to get pregnant? We talked about that as well. See, some of these questions have been answered, but I apologize. The timeline, it might have just come in before I just talked about it. So uterine fibroid embolization, we talked about the ability to affect pregnancy. If you have large fibroids that limit your fertility, uterine fibroid embolization could potentially help. However, though, if you have good fertility and you can wait to have a procedure, I would say go ahead and wait. I would not have anybody touch your uterus until you have gotten all your kids out the way, because anything you do to your uterus, I don't care what it is, myomectomy, uterine fibroid embolization, ablation, could have a negative impact if you have very good fertility to begin with. Okay, so I hope that makes sense, but I can talk more about it if you call us. If I come from out of state, how long do I have to stay in St. Louis for recovery? So we do get people from out of state. Some people drive relatively far. We have people that fly down from different states. One just recently came from Alaska. Typically, I kind of gauge it based on like how far you came from. If you're driving, if you're flying, but for the most part, we like people to stay in town for 3 to 4 days. If you come from really far, we like you to stay for at least 5 days. This is because we want to monitor you, make sure everything is fine before you leave. We want to be able to check on you. Typically, if you come from out of state, give us a call. We have different arrangements for people that come from out of state. We can help you out with some of the things, navigating in terms of hotels and stuff like that. So definitely hit us up for that. Guys, it was a pleasure to chat with you. This is so much fun, and we'll be doing this again. Yeah, definitely reach out to us if you have any additional questions. If you want to get the free virtual screening, just give us a call on that number, or you can even email us, and then we can give you a call, or you can text us. You can text that number, and then we give you a call back or a text back, and then get you taken care of. Okay, y'all take care. All right, bye bye.